Welcome, Dr. Cameron Hopkins from Chiro for Family Wellness. Thanks for watching this video today on shoulder, arm and hand pain. This is quite a common condition we see in our practice. Now when I say shoulder, hand and arm pain, what we mean is a lot of our patients present with soreness across the shoulders or the shoulder blade or a pinching feeling between their shoulders, stiffness of the neck, pains or tingling or numbness running down their arms, fingers, into their hand. These sort of symptoms. And we can often find that these are associated with headaches. So these are the sort of things we're talking about when I discuss this video today. Now, what are some of the causes? Well, there's a lot of causes. Some of the more common ones are postural problems can cause this, where people have what's called a forward head carriage when it's presented forward. Poor sleeping pattern. Often some of our patients are sleeping on their stomach and twisting their head to breathe. We always tell them the best positions to sleep on are on their side or back. Another common area we see, which is one of the bigger ones we see, is arthritis can cause this. Now, jump on one of the other videos that discusses arthritis and how that affects the nerves and potential problems down people's arms and fingers. It's a great video. But I want to talk mainly about trauma to the spine. Now, this can happen very early on when we're playing contact sport as young children. It can happen as we get older through jobs and repetitive things we do. Let me explain how that works. Behind me is a diagram showing the spine. We can see we have 7 cervical and 12 thoracic vertebrae. Each level has a nerve coming out. Now the nerves of the neck form and travel down into the shoulder blade area, down the arm and into the fingers. So as chiropractors look for areas where those nerves may be compressed. I'll show you from this diagram how it works. This is a plastic model of an adult spine. We can see, this is the neck itself, we can see the bones, the disc pads lie between them, and every single level of nerve comes out. Now we need to find that those nerves aren't being compressed or irritated in any way. But as a chiropractor, commonly, and there's many causes that give us misalignments or we call subluxations, bones go out of alignment in our neck or back. Now it could be a minor accident that causes, it could be a major accident, but these vertebrae sit misaligned and often irritate and even pinch or choke these nerves. And as a result, we can develop shoulder pain, blade pain, pins and needles numbness right down our hand and even into our fingers. Now as a chiropractor, we gently and safely realign that joint and that bone and take pressure off the nerve, which is totally pain-free and extremely safe. Now while I'm on that point, please feel free to jump on some of the other videos. We have some great videos that discuss chiropractic, how it works, what we do as chiropractors, affordability and safety as well, which is very important. So please feel any time to jump on some of those videos. Now as a chiropractor, we've had over a 85 to 90% success rate in dealing with shoulder, arm and hand pain. Now what we initially do is we bring you in, we go through a thorough history, we do an examination which may include chiropractic, orthopedic and neurological tests and often x-rays, and that helps us pinpoint the root of your problem. Now if we feel we can help you as a chiropractor, we do a report of findings, and that's when we give you material to take home that goes through what we're going to be doing, how frequent you'll be coming in to see us, and maybe an exercise program. Now if we feel at this point that chiropractic can't help you, we may send you off for either further tests or to a different specialist or other healthcare profession. So please feel free that if we don't think we can help you, we'll send you off accordingly. Now on this point just briefly is, we have a lot of our patients that are on medication and painkillers. Now we're not saying for a moment that some of our patients shouldn't be on that, but we have a lot of our patients have these sort of symptoms and are being told either by their local doctor or other sources to continually either put up with the problem or take medication or painkillers. Now, like we said, in 85 to 90% of cases we get great results. A lot of cases with people with medication or painkillers, we reduce that through chiropractic or even stop that altogether because we've taken the pressure off the nerve in the joints, which is leading to their pain. Another great alternative with chiropractic is not having surgery for these sort of problems. Now, we've prevented quite a few people over the last 20 years in my practice from getting some sort of surgical intervention to help them with their shoulder, arm or hand pain. So those two options, please feel free to talk to us first before you make that decision about continual medication, putting up with it forever and a day, or possibly being told you need surgery. So I hope you enjoyed this video today, and yes, chiropractic has a great success in looking after shoulder, arm and hand pain, including tingling and pins and needles. We look forward to talking to you soon. Feel free to ring us anytime to ask any questions, and bye for now.